Well, Nissan, thank you for making it here. Before we hopped into these chairs, you were on a journey to come here today.
Oh yeah, quite a journey actually. Yeah, not at the right, not at the perfect timing. When there's missiles flying over Tel Aviv, I took the last flight out to come here, and I literally just landed here after 20 hours on the road, or on the air, actually, to be here with you.
Thank you, I appreciate that, I really do. And you lead Augmetics, which is a AR headset that's used right now in spinal surgery, right?
Yes, yes, that's right. I founded Augmetics, and I'm the CEO of the company since 2014. And my goal was to develop an informative system that surgeons can use during the surgery and get all the information they need to treat their patients better. So we designed an augmented reality headset that projects all the patient's anatomy directly to the retina of the surgeons, so they can see exactly where they need to operate, where to place an implant, and do the surgery better and safer.
Where do they receive that information from in order to get that image onto their retina?
So we acquire, I mean, all patients that come to surgery usually, and I'm talking about spine surgery at first, right? They all come to surgery with a preoperative CT scan or MRI scans. So we take the CT scan of the patient, we reconstruct the 3D model out of it, and we register the imagery of the patient to the real patient that is lying on the surgical table. So actually the surgeon sees all the patient imagery and the 3D reconstruction of the anatomy in direct view, as if he or she have X-ray vision.
Wow.
Yeah, so they can see through the patient's skin and tissue and look straight at the anatomy of the patient and spine and bones and everything that we reconstruct, without even opening, the skin of the patient. And by doing that, they can better align their instruments and place their implants precisely in the correct location that they want.
So you're giving that information right now to the retina, the surgeon's retina. Medical devices, med tech, health tech, digital is also starting to obviously get more traction on the robotic side. So how would that interact with, say, a platform like a Globus or a Mazor or some of the others?
Right. So all the platforms, such as robotic, surgical robotics, such as the Mazor that Medtronic have, or the Globus, and other, robotic systems, they use the same concepts of taking a pre-op CT scan of a patient and register it to the real patient on the table. And then obviously all the systems are in the title of computer-assisted surgery devices that help the surgeon navigate their instrument and implants accurately. We have the same goal, but in a different way. We provided data directly to the surgeons so they can see and analyze this data during the surgery. The robots, on the other hand, are just placing guides. It's like a drill guide that they place over the patient, and the surgeons just drill through that guide. It's not enough to have a robot to place a guide. Surgeons do want to be in control and to visualize exactly where the drill goes. That's why most, if not all, the robotic surgeries have also a navigation system. That's what Medtronic did when they acquired Mazor. They integrated it together with the Stealth, which is a navigation system. We are indifferent than any other navigation system. We just provide the data directly to the surgeon's retina instead of looking on a screen. Any surgeon working with a robot has to turn his head aside and look on a screen while he's drilling inside a patient. That's what we're trying to solve that gaze away from the patient. We want him or her to be in, in all to give all the attention to the patient and look straight down when they drill, place an implant, or do the surgery.
So it makes sense on the orthopedic side. Does this require, one of the things about orthopedic robotics, and it's got such quick traction, it's easy to index, it's easy to take an image, it's easy to register that. When you start to get into soft tissue or other platforms, does Augmetics have the potential to be a platform technology beyond spine?
Well, yeah, that's actually, we are currently now in the first phase of this intelligent surgery. The first phase that we are also focusing at is to provide the data to the surgeon. Surgeons, they make the decisions where to cut, where to place an implant, but it's a very important phase to bring the data in real time to the surgeon during the surgery. What we can do with our technology, it's something that only imagination, can be.
You're teasing us, Nissan. You're teasing us.
It's only imagination that can actually take you to realize what we can do with this. It's literally an X-ray vision. If you can think about what could you do if you really had X-ray vision and look through stuff and see all the information, you will be. I'm sure that most surgeons already see the future of this technology, where we can take it, and that's what we're working on right now. That's something that any robot cannot do, because robot just guide an instrument. But we can actually do much more than just placing screws or implants. The surgery is not only about the implants. It's about treating a patient. If it hurts, you need to take some tissue out, maybe soft tissue out. So all that is taking into account when we're developing the second phase. Second phase will be not just providing information or data to the surgeon in real time, so they can analyze and make the decision. But second phase is going to be suggesting surgeon what to do, or maybe even giving alerts of what he shouldn't do during the surgery. That's the second phase. No other system right now is actually giving that advice. But that's going to be the leapfrog of this technology, when we can actually tell surgeons or advise surgeons what's the best practice to treat their patients.
And I'm just imagining, so you mentioned earlier, if we're going to just talk about putting a screw in, that's sort of assist, right? I can assist you in placing a screw, or just doing anything surgical. I can assist you with a guide of some sorts. And maybe I got a scope tied to that, and then maybe I have a guide tied to that, and I run some sort of driver down that. So that's one. But from what I understand, what you might be able to do with your platform is not just take the imaging data from that patient, but all the historical data on a cohort of patients that maybe you can get a baseline information and offers the surgeon more precise advisement, but doesn't make the decision for him or her in the procedure.
That's correct. That's one of the paths for surgical intelligence to go. You can use historical, data from other patients, from other surgeons' techniques. AI is now taking a major, part in all the surgical space as well. And we're definitely looking in that space and working on that space too. And the trick is not only to look at historical data, but actually look at the patient that the surgeon is operating right now and understand what's going on there and what he or she should do. That's a real-time analysis of the data, of the, of what you see in front of you. But surgery is not only planning a trajectory with a robot. The robot do not know what's going on during the surgery.
That's right. It doesn't have a judgment.
It doesn't have.
It can't apply a judgment.
It cannot see.
Yeah. Well, that's interesting. It cannot see.
It cannot see. Only surgeons who are there on top of the patient, they see.
So I've been at this for 32 years in the search industry and building startups. And I don't know if I've seen such a wave of a single baseline technology come around that is loaded with intelligence, and that is the imaging component of surgery. And that includes augmetics, that includes any other high fidelity data gathering, either preoperatively or perioperatively, advising the clinician, the surgeon, the work team, and assigning intelligence for real-time decision-making in the middle of a procedure, beyond planning. And I do believe the next 3 to 5 years there's going to be a substantial breakthrough just because of imaging technology coming out, and that puts you right in the center of it. Where did this technology come from?
So I started a company in Israel. As you well know, in Israel we have very talented engineers who constantly working on pushing the envelope and developing cool technologies. So we hired quite a few engineers there with vast experience in computer vision algorithms, and also worked in some medical device companies. It started in Israel, and it still is. I mean, we are a US-based company. However, we do keep our R&D center in Israel. We have 50 people in total in Israel that are working on this innovation and new innovations.
So we're at LSI. You've raised, what, to date, 36 million or something like that with augmetics? Is it something around that area?
63.
63. It's my dyslexia coming in. 63 million. What's got you at LSI here visiting, beside visiting me?
Well, it's always good to make connections, and I think it's the first conference that post-COVID, which is something that I would never miss. To meet again all the people from the industry. I thought, I was talking to one of my colleagues and said, listen, we just closed, last month, we closed Series C with $36 million. That's maybe the 36
That's the
came
number
from,
I had in my
right?
mind.
So we just closed Series C with $36 million. Is there any reason for me to come here? Because I'm not raising anymore. I mean, we just closed a fundraise. He said, listen, you're always raising.
That's true. That's true.
So even if we're not seeking for, to close an investment next month, this conference is gonna strengthen the connections for investors, for the in the market. Analysts are here. This is all important, to build the relationships for the long run. That's what I'm seeking here. Yeah. And presenting the company, obviously, I want to share what we do. I think it's a good platform to share what we do. I never hide, what we're working on. I was very open in social media and on the website. I never took the stealth approach. So
I love your presence on LinkedIn. You're pretty active there. So
yeah. So I think it's only beneficial for the company. I never saw any one case that what I said stood against me. It never happened. That's why tomorrow when I present, I will share some cool stuff that we're working on.
Awesome. Well, I'm gonna look forward to that, and I really thank you for taking the time and making the long journey here. I'm humbled, so I appreciate that, and it's good to see you again.
Thank you very much.
You bet.
Yeah.
Appreciate it. Thank you, my friend.
Thank you.
Joe Mullings from the LSI conference. Be well.